Hello, I'm Jeff Braven, Executive Director at the American School for the Deaf. In October 2022, the American School for the Deaf announced the launch of a statewide needs assessment to better understand the ongoing impact that COVID-19 has had on the Connecticut Deaf, DeafBlind, and hard of hearing community and their communication accessibility, health, and employment outcomes. Innivee Strategies, a deaf-led company, held 8 focus groups and distributed a community survey to gather this important information. This needs assessment was made possible thanks to funding from ARPA, the American Rescue Plan Act, through the State of Connecticut Office of Aging and Disability Services. Today, I am pleased to inform you that Innivee Strategies has completed analyzing the data and has delivered a final report that identifies the key observations and recommendations based on the community's input. Hello, my name is Shane Feldman, and I am the CEO of Innivee Strategies. Through our recent work on the Statewide Needs Assessment, and based on the data we received, our primary observations are as follows. Communication barriers significantly limit deaf signers' access to healthcare services and lead to disparate healthcare outcomes. Appropriate interpreting access in healthcare is required to ensure deaf patients obtain equitable care and results. Video relay interpreting, VRI, has been an inadequate communication solution in healthcare settings, and different approaches to meeting this need should be explored and utilized. Clear, transparent masks should be made widely available to any and all professionals that may engage with deaf people, along with training about their importance and their use. Generally, deaf individuals feel that the level of access to State of Connecticut government programs and services are unsatisfactory. The deaf community has expressed a significant need for a State of Connecticut government-level office or department that specializes in deaf services. Similarly, there is a significant need for employers in the state to participate in training on the Americans with Disabilities Act, ADA, sensitivity awareness training as it pertains to deaf employees, and to improve overall communication access in the workplace. The remainder of our findings, as well as our company's recommendations, can be found in the written report. The American School for the Deaf and its partner organizations will use this report to guide their strategic priorities and plans for the next few years. It is our hope that the State of Connecticut, healthcare providers, employers, and other groups who engage with deaf, deaf-blind, and hard-of-hearing community will take this opportunity to review the report and consider how to improve the quality of life for all Connecticut residents. On behalf of Innivee Strategies, the American School for the Deaf, as well as Connecticut Association for the Deaf, Communication Advocacy Network, and Hear Hear Hartford, we wish to extend our appreciation to everyone who participated in our data collection efforts. Thank you all.